Rachel here from Precise Posture. In this video, I'm going to give you a simple sequence to help relieve SI joint pain. So the SI joint is the sacroiliac joint. That is the joint that connects the parts of the pelvis to the sacrum in the middle that sits in the pelvis there. And when your pelvis and your spine gets misaligned, that can cause extra pressure on that SI joint, normally resulting in lower back pain or some pain down the leg. So in this sequence, we're going to focus on realigning the pelvis and the spine, bringing them working together again, as well as not ignoring the shoulders and the feet and the legs, because the whole body works as a unit and plays into the stress in the SI joints. So we're going to start in the Flexion Abdominal Position. So go ahead and lay down on the ground, grab a yoga block or a really thick pillow, and bring your feet onto the wall. Now you're not completely at 90 degrees, I actually want you closer towards the wall. So it's about a yoga block's distance, or about 6 inches your bottom is away from the wall. All right, so you feel like your knees are coming into your chest more than at 90 degrees. You're gonna take that block and you're gonna put it in between your knees and just hold it there. Now make sure your feet are straight, slightly pigeon-toed, and about hip width apart. So you can also use the block to check that as well. And you're going to relax with your palms up at 45 degrees from your body. You're just going to hold this block here. You're not squeezing it, all right? You're just holding it there, but you might feel quite a bit of work in your inner thighs, in your hip crease, in your groin. I also want you to really try to relax your lower back and relax your stomach. So feel like your tailbone is going closer to the ground than engaging your stomach, holding everything in there, and your tailbone coming up. All right, I want your tailbone to kind of start to settle down into the ground. So after 4 minutes in this position, now you might be shaking a lot with your legs, but hopefully your back is calm and relaxed and your legs are doing the work. You're gonna interlace your hands above your chest. You're gonna keep your elbow pits facing each other, okay, so not hyperextending like I like to do. Keep those elbows facing each other. You're going to drop your hands behind your head here. And when you touch the floor, come back up. Now, if you can't touch the floor, that's totally fine. All right, just work as far back as you can. You'll find as you start to do this more and more, your range of motion is going to increase. Trying to keep the back relaxed, trying not to let it arch up too much, but not necessarily using the abdominal muscles to press your lower back into the floor. So do about 3 sets of 10 or 30 of those. For our next exercise, it's called ADduction, and you're going to scoot back a little bit away from the wall so you're not quite at that squished in position. Now you're bent at 90 degrees. Okay, so your knees are directly above your hip joints. Feet still straight up to the sky, slightly pigeon-toed. You can actually widen your feet a little bit more than pelvis width apart. You can actually go to the outside of your hips and widen your feet there. Or if you don't have a lot of range of motion, keep your feet pelvis width apart. Okay, now you're gonna drop your knees out to the side. You're gonna roll onto the pinky sides of your feet. And then you're going to close your knees in and touch each other. And you might find if you do suffer from SI joint pain, if there's a pelvic misalignment, you can even look at your knees and see, are they level, or is one side forward of the other, one side closer to the ceiling? And that's going to give you an indication of what pelvic misalignments that you might be dealing with. So you're going to open your knees, let it go to that full range of motion, and close your knees. Now make note that as you do this, your feet are probably going to want to start to point out to the sides like a duck. I want you to keep your toes pointed straight up to the ceiling, but you're still rolling on the outside of your ankle on that pinky side toe, so supinating your feet here. Back and forth. Another thing that I want you to make sure that you focus on when you do this is not letting your pelvis necessarily move back and forth and rock here. I want you to try to keep it as neutral as possible, keep it relaxed, and make your legs do the work here, not necessarily rocking your pelvis, pushing it in and arching it up, right? Keep a nice neutral position as you do this. And if you can, I want you to try to do 3 sets of 20 of these. Now your legs might be shaking a little bit towards the end. So to finish off our sequence today, we're going to do the trusty Airbench to really solidify that strong pelvic position and press out any misalignments that might still be remaining. So you might channel your elementary school wall sit. We're just going to do it a with slight adjustments here. So make sure your feet, again, are hip joint width apart, slightly pigeon-toed. Make sure those feet are straight. You're going to walk your feet out, and you're going to sit down on that wall. Now, you don't have to be exactly at 90 degrees, especially if you do have some knee pain. You can come up the wall a little bit, but I want you to be able to see your toes as well. So your feet aren't tucked into you like this. You can see your toes. All right, and you're pressing back into your heels. Now here's the kicker. I want you to press your lower back into the wall, so you might feel your abdominal muscles engage a little bit. Press that lower back. Again, you can check that knee misalignment if you do have SI joint pain. That's an anterior to posterior disparity showing up, so you can look at your knees here. Are they in alignment, or is one knee trying to go forward of the other? Try, if that's happening, to pull that hip back onto the wall and press that lower back there. Now, it doesn't really matter if your shoulders come off the wall or your head. I'm more worried about that pelvic and lower back positioning. So try to hold this up to 2 minutes, but if you can't do that for right now, that's fine. Work your way up to that. So thank you guys so much for watching. I hope these exercises help you out. Now remember, these are generalized exercises for the cookie cutter posture that might be presenting with SI joint pain, but your pain might be presenting for a whole nother reason, a whole nother mass of posture deviations or misalignments. So if any of these exercises cause pain, please do not do them. Just go ahead and skip the one that caused pain. And if you need any extra help, please reach out to me and we can schedule a complimentary discovery call where we go over your specific pains and talk about what we can do to change your alignment and posture and get you back to living a healthy, active lifestyle. So test out the exercises and I'll see you next time.